Welcome back to the Doc and Doula Show. We are here with the amazing Dr. Bonnie Wims, founder of Wims and Associates, and we have the fabulous Erin Carroll Manning, the founder of Gentle Giraffes Newborn Care. Hi, ladies. Welcome to your show. My name is Jackie Zook. I'm the founder of Nexon Teen Media. Today on the Doc and Doula Show, we are going to be talking about the struggle moms and parents are having to work and care for their children. Do you guys first want to talk about how is this taking a toll mentally and emotionally, and how can we balance? So, Erin, would you like to start with this?
Sure. Good evening, everybody. I'm Erin. As Jackie said, I'm the owner of Gentle Giraffes Newborn Care. I'm also your personal newborn care manual. I take care of everything for you guys. So as Jackie said, we're going to talk about the struggles parents are having both mentally, emotionally, and scheduling wise with being home with their children and having to work. Some things that I have found that have worked really well over the times that I was a full-time nanny is every day is the same. It seems very monotonous and kind of dull, but you want every day to be the same. So a really quick schedule, and this is what I actually do with my newborn clients too, is that you get them up every day at the same time and you feed them breakfast at the same time. So you get them up at 7, they're eating breakfast by 7:30. And then you have whatever could be by 8:30. It could be, all right, we're going to have some free play, because usually when they go to school, especially if they're preschool age, when everybody's kind of arriving, it's free play. So get them out some puzzles or some crayons or maybe a sensory item or something like that for them to do for about a half an hour or so. And then you can sit down and have them do some kind of work, whether it's having them, depending on their age, having them do something on the iPad, or even if it's just maybe putting colors in boxes or something like that. And then throughout the day, you kind of go along with different scheduling. And then at the end of the day, you have them go to bed every night at the same time, and you do the same routine. And that helps everybody stay on the same page, but everybody knows what's going to happen, and you can release, or you can not have as many tantrums or meltdowns or those types of things, especially with like toddlers and preschoolers, because they really do like to know what they're doing before it's actually happening, because it's like empowering them and giving them and treating them like they are a child. What do you say, Bonnie, on that?
I'm so happy I was jotting down what you were saying, because I'll get to that in a second. But yeah, so, well, I'm Dr. Bonnie Wims, and I am a virtual therapist. I work completely online, and I have been for the last 8 years, but now obviously there are more people also working online. And I'm committed to removing obstacles to mental wellness through online counseling. And so, yeah, when Erin suggested this topic, I was thinking about it. And the first thing that came to mind was, I don't know if you guys saw a few weeks ago, it came across social media, but it was 2 toddlers on like the baby cam, and they were playing quarantine. And so they were put to bed, and they'd gotten themselves, of course, out of their beds, and they were playing with each other, and they were playing quarantine, and they knew the word quarantine. They were saying it appropriately, and they were putting each other in quarantine. And, kind of amusing, kind of cute. But from a psychological standpoint, I thought that was huge, because there's no child at, I don't know exactly their ages, but they were toddlers, that is using that word and knows what that word means in kind of a normal world. So clearly they're picking it up from outside sources. So I love when you're talking about the routine and the schedule, because I think what we're not realizing is how much kids are going to pick up our stress and our anxiety, and also listening, even if the TV's on low, the news, or conversations you may be having, you and your partner, or any kind of, kind of adult type of topics. So all the more reason to give them consistency, to keeping to a schedule, and making sure they're playing, making sure they have this routine, because the child just doesn't have the psychological brain power. They don't have the maturity, the emotional wherewithal to understand, even though they may be able to use that word and play with it. You know, we can't wrap our brains around what's going on right now. So just imagine the feeling of complete, you know, disempowerment and fear that can come with all of the things that are going on right now. So to try to understand that, it's not something I think you can sit down with a child and really explain in big terms, but it's much more helpful if you give them small bits of information about it and then just stick to a routine, which also helps us. I don't know about you guys, but it certainly helps me if I, you know, get up and I stick to a routine, because the lack of that routine then leads you down to all of those places of worry and anxiety and what's going to happen next. And so it helps everybody to stick to that routine, but especially with the children. So I totally agree with you.
And I can completely agree with you on how not having a schedule, they can go down a slippery slope kind of thing too. Because if we think about it, most of these kids have either had nannies, they go to preschool or school in general, or they go to daycare. So they have had a routine majority of their life, from like 6 weeks, you know, when they started as early as 6 weeks to as late as 4 months, when they probably had some type of routine with that. So that's what they're used to. And then all of a sudden their lives have been like basically torn apart, and they don't know what's going on. They can't verbally express what is going on in the way of understanding it and realizing, you know, on an intellectual level what is kind of happening, but they do express it through their feelings. They do express it through regressions. They express it through tantrums. They express it through not sleeping, having potty accidents, all sorts of different stuff in that regard. Some kids eat emotionally. Some kids, you know, want to play a game because they want to tune everything out. So there's all these different things that are going on that kids are expressing because their lives have been uprooted, and then parents' lives have been uprooted because they're stressing that they've got to get to work. If they don't, because of people are losing their jobs left and right, and then you have the tension and all that all at home. So to both of our points, having the schedule keeps everybody on track, and it keeps their mind engaged in something other than what is happening outside. I had a nanny family years and years and years ago. I think when we had the Cold War happening, or the Gulf War, I don't know, whatever it was. Something was going on, but the news was on all the time because the grandfather was living at the house and that's what he watched. And I said something to the mom, and I said, look, you know, we kind of need to shut this off, because even if the kids aren't paying attention to it, they're paying attention to it. And it was coming out in different ways. And at like 1-2 years old, we really don't want them listening to like war stories, and not that that they're bad. It's just this was reality, and they don't need to know this. So I could see it from the kids too back then, of just something small like that, compared to imagine what's going on now in homes that everybody has kind of is living this. It's not just on the news. Yeah. And also, like I said, kids feel things. So, I mean, I'm sure you know that too, from being a psychologist, understanding that kids feel more things than adults do. Because adults think more on an intellectual level than they do on a feeling level. But we still internalize all those feelings too. And even if we're trying to hide them, that tension or that stress is being released into the home, and it can be, you know, just a ball of tension in the home.
When it comes to structuring time, like how long should these, like playing on the iPad, like how long should these time like slots be? Because sometimes when kids are on for too long, you know, parents get busy in their work. I'm assuming sometimes that happens, and kids can get bored, or they, you know, start having whatever they're feeling. Like, what would your recommendations be in terms of figuring out how long should these time slots be?
So it really is going to depend on the family and what their rules are for the iPads and why the child is on them. There are a lot of studies out there that say that kids on screens tend to become more aggressive, especially if they're playing aggressive games. And sometimes even at a toddler age, they could be playing an ABC mouse game, and for whatever reason, they throw tantrums when you take the iPad away, that kind of things. They're internalizing whatever those emotions are for them. So it's really going to depend on the household. I personally say probably no more than 20 minutes at a time. And you really have to stick to it and be consistent about it. So a toddler may throw that tantrum the first several times, but if you're consistent about it, they are learning what the boundaries are, and they're going to eventually adhere to them, especially if you are consistent about them. And that consistency can play out as they get older too, with different things as you implement boundaries or rules or that kind of stuff on them.
Is the first thing I wrote when you were talking earlier was about consistency, because I think I learned that lesson when I had my first son, and my brother, who already had children, said that to me. He said, you know, don't use something as a potential punishment if you're not going to stick to it, because the child, even at a 2-year-old, probably even younger, they recognize that, right? They recognize that they can get away with it. And so there's no sense of you being consistent with what the guidelines. So whatever you decide on, stick to it, without saying, oh, well, I'm just tired today, so why don't you have an extra half hour. Now, I do understand that this is tough, and I think maybe we should have said this at the beginning, because I think you probably recognize this with your work more than I do even. It's really hard out there right now, and I don't have small children anymore, but I just said it to my husband the other day. Can you imagine if we had like a sullen 12-year-old right now, or a screaming toddler, or because our time is our own, and when we go through these roller coasters and mood swings and everything that's happening for adults, to then try to manage the child's too. I really feel for people, and I just want them to know that, if they need to reach out, obviously there's no shame in that. It's like, this is tough stuff that we're all trying to do, and it's been going on for such a long time that, maybe for a week or so, it was sort of like summer camp, and now it's like, no, not at all.
It's reality. It's turning into a reality too, because the school systems have closed for the rest of the year. And I was talking to somebody the other day, and I'm sure you've probably heard this, nobody really knows where those kids are going to go. Like, are they going to go back to being in the grade that they are currently in now, or are they going to be pushed ahead? And how, what's kind of going to happen with those kids?
Yeah.
It's tough. It's tough for everybody in that. This morning when I was doing my video on reflex for newborns, what kind of went through my head is new parents are stressed in general, especially the lack of sleep. They don't know what's going on. They need some extra support just taking care of their kids in general, when we're in a perfect world. And having a child during this time that has probably either severe reflux or just has reflux in general, and parents putting that stress on themselves of wanting to figure out what's going on with their baby and make sure that they're getting their baby to stop crying, which can be really hard with reflux. So what really went through my head is that make sure that we have compassion and understanding for those babies, but also for the parents too. Like, they need to have that, because in a perfect world, like I said, I've seen so many moms break down because they just want to make sure that they are doing right by their child and helping their child. And so in a situation like what we're in now too, it can be even worse too. So just any outsider, even if you don't have children, just have compassion for these parents.
Can I ask you about this? Because I've certainly seen a lot of comments about it in social media, and even spoke to some clients myself about the urge to maybe over-program, to fill up every minute of every day. This is the chance to teach my child a foreign language, or, just some of these well-intentioned crafts that are coming across all of the things. And so I just know from my perspective, I'm hearing from parents, kind of a guilt feeling of, yeah, that looks really cool, but I don't have the time or the money to go buy this craft material, or, just the kind of pressure maybe that's being put on parents to maybe this is the time to really get in there and create this perfect child with the, you know, do
I
you know
do
what
know
I'm
what you're
saying?
saying, and I actually think it's the opposite. I think we need to go back to probably when you and I grew up, and we weren't pushed to do a lot of those things. But what we fostered was imagination. We fostered what my husband calls toddler politics or kid politics between the kids. We learned how to work things out ourselves without always bringing in a parent. We learned things that we wanted to learn. We were bringing in our imagination for all sorts of things. We could be playing with, pots and pans, and all of a sudden we have a rocket ship that's going off, that kind of stuff. And I think that's been lacking with filling the kids' time with something that their brain is being taught all the time. I also feel that kids need downtime to be able to process all of that stuff that they've learned, so that imagination play, or that even that one day that they have to do whatever they want, even if it is just to lay on their bed and read a book, is really good to process everything that they've been doing. So I personally think that they should actually tailor back all of that stuff and really let the child-led learning, let them do what they feel they're interested in. Although, offer them those things so that they can learn it, but you don't have to feel guilty because you are not getting your child to learn a third language, or they're not taking calculus when they're in middle school, or
Yeah, I was kind of thinking back, like I was thinking, okay, let's fast forward because this will pass.
Yep.
I believe it. And just imagining some of these, grade schoolers at their high school graduation. Is anybody going to say, oh, well, it's really unfortunate he missed that last 6 weeks of school because now he's not going to get into Harvard? I just don't think it's going to. I think there's obviously things that their schools had planned, and that there were things that they're missing. But I don't think it's all going to come crashing down. I think the schools are obviously going to be planning and having to work out what was missed and how to incorporate into the new year. But I just think, we all need to relax just a little bit. When my firstborn was a baby, first babies, and you're like, every little thing they do, you're freaking out about. And he turned 12 months and he wasn't walking. And I remember going to the doctor for his 12-month checkup and saying, I don't, and but he was doing everything but, and I remember him saying to me, when he's 18, you're not going to remember the date, and how old he was exactly when he walked, because developmentally he was fine. He was a big baby, and he was taking his time on when he was going to do that. And of course, within weeks he was. So that same sort of philosophy is like, I think, relax just a little bit, have some fun with this, and know that it does feel super intense and super important right now, but they'll be okay. They'll be okay. Some of the academics here and there, but it'll work
absolutely.
out.
Yeah, because they do have the whatever they missed, or even something new. It's not like you already know at this point that they don't have something major that they're missing. It's just information that the teachers are teaching them that they'll learn at some point if they choose to learn.
Yeah. Thinking, being kind to yourself, and really move away from some of the judgments of yourself, comparing yourself to other parents. Everybody looks good on social media. We don't post anything of us looking right. I don't post when I haven't washed my hair. Parents aren't posting when their kids vegging out in front of the TV and not doing anything. Don't get too caught up in that, don't you think?
Yep. Oh, absolutely. Don't compare yourselves. One of the biggest things that I've had to learn in the last probably 5 or 6 years, and I still struggle with, and I think everybody does too because of social media, but when you compare yourself to somebody else, you cause yourself more stress, and just do what you feel is right for you, and what makes you happy and what makes your family happy too, because at the end of the day, that's what's really more important. I have a couple of neighbors that have kids that are like, they each have like 2 or 3 kids under 5 years old, and we live in a huge neighborhood, and it's really nice to see children out riding their bikes, laughing, playing like with themselves, in their own like yards or whatever, but still seeing them kicking a ball around. I've lived here for 15 years and I don't think I've seen this many kids out or heard this many laughs and voices out the entire time that I've been in my neighborhood. And it's been really nice, and it brings a smile to my face too, because kids are enjoying themselves. And that's important.
I think remembering that, you know, don't bring our stress and our worry about things to them and allow them. I totally get what you were saying. And I'll actually thank you for saying that we're somehow around the same age, because I know I'm a lot older than you, but I'm going to take it, Erin. But I do remember, you know, summers were about being outside, and you went outside right after breakfast, and it was like, just come home before dark, you know, that was the plan. And so I know it's a different world, and that's not always possible, but that, I think you've hit on something so key about the imagination and allowing for kids to be kids, because if you're okay, they're going to be okay.
Exactly.
Yeah.
Yep. I think that's a great note to end on, that if you're okay, the kids are going to be okay.
Yeah, there's our motto.
Yes, yes. And I think we should probably, you know, keep that while we're going with this pandemic too. Jackie, do you have anything to add?
Yeah, how can they? Well, first of all, I thought you guys were amazing. Thank you so much for all the insight today. Tell everybody how they can follow you both on social media and stay up to date.
So you can follow me on Facebook at Gentle Giraffes Newborn Care and Family Services, or Instagram, which is Gentle Giraffes Newborn Care. And either email me if you have any questions at gentlegiraffes1082@gmail. And you can certainly call me anytime as well at 617-233-2494. Or you can check my website at gentlegiraffes.com.
Yeah, I'm Dr. Bonnie Wims on Instagram. That's my website. I think Facebook, Bonnie Wims, and then my page is Wims and Associates. My email is bonnie@wimsandassociates.com, and that's AND, not the little sign. Yeah, I think that's it.
Great
Don't have anything
insight,
else.
guys. I know we have a lot of upcoming shows and topics coming soon, so everybody can stay up to date and follow them on social media, and stay tuned for what's next.